Have you or your partner recently undergone extensive surgery or possibly have sustained an injury where the recovery time is long? And after that injury or surgery, you're wondering what kind of touch is going to feel best for you and how to ask for it?
Or have you been the caretaker and tried to get what your needs met, try to get your needs met or something else along those lines? Have you been able to do that? Well, this Naked Talk's for you.
Yes. So Naked Talk is where we get naked in a conversation of intimacy, relationship, and sexuality. We strip down and expose the bare facts so that you can learn what it takes for your love to thrive. I'm Elizabeth Wood.
And I'm Dan Powers. And I forgot to turn my phone off.
So this evening what we want to talk about is how to return to intimacy after injury or any type of, let's just say knee surgery, shoulder surgery, hip surgery, anything that requires sort of a sustained period of rest and recovery. How does the person who sustained that get what they need? And then also, how do we take care of the caretaker?
Right. As a caretaker, so as many of you may know, Elizabeth just had hip replacement surgery, and I've stepped into a role that I'm not really familiar with. I do some ski patrol work, so I'm used to helping people off mountains and things like that. But in a sustained support role, it's been a little bit different, and it's had its challenges that we weren't prepared for.
Yeah. So when your partner is whiny and in a lot of pain and needs a lot of different types of care, what can you expect out of your relationship? So I'm just going to talk obviously from my perspective. I've needed and wanted a lot of really nurturing, really gentle, soothing touch. And, if I just stick out my arm, I need to ask for what I want rather than making those noises, which I'm prone to do. Because I think he just gets that I want nurturing, comforting touch. And what's been so necessary...
At the same time, when I have reached out to do some of that comforting touch, there's been places that I've touched or ways that I've been touching that haven't been quite comforting for her. And I haven't quite known that. And I think parents that have kids understand this as well, because kids start to cry. I know as a new father 20-some years ago now, we struggled with what it was to do when our kids started crying. It's like, well, are they hungry? Have they pooped in their pants? Do they just need cuddling and affection and touch, whatever that is?
Yeah, and it's not that I went back into an infantile state, but when you're under the influence of all those pain medications and the anti-nausea medications, your style of communication isn't always quite clear. So I then, in a moment of clarity, sat down with Dan and said, what I need for my central nervous system is I need calming and soothing touch. It isn't for arousal purposes. This isn't for, purposes of, increasing the eroticism. It's just I needed that calming touch. And then I also had to share with him the different places that were, if you will, off limits. Hip surgery is a major surgery, and so I have, a scar about this, 5-6 inches long, and the whole area, that to me is off limits.
5-6 inches? I thought that was only that long. 5-6 inches, that's like a foot.
Okay. Anyway, I
threw her off.
Okay, go ahead, honey.
So she gave me guidelines on what it was that she needed as far as the touch was concerned. Because the hip surgery is so large, not only is the incision about that 5 or 6 inches long, but her whole leg was then in pain. It radiated all the way down to her toes. There was a lot that was going on with it. And even up on her hip a little bit higher than that as well.
Oh, and then what I was going to say is Dan knows Reiki, and so he really knows the value of comforting touch. And when he wanted to give to me in that manner, I could feel the heat from about, this distance away from my leg, and it was too much. So I would go into that, and he wouldn't know what was happening. So as best you can, be really clear in asking for what you want. And don't ask for it as you're nodding off to sleep because your last painkiller just, kicked in. But really say, this is what I'd like from you, so that the expectations are managed and met, and that there's no screeching when your partner does something that isn't the most comforting to you. They don't know. They still need your help. They still need you to be clear with your words. And if it doesn't feel good, maybe you can guide them. We teach touch all the time. Maybe you can take and guide his hand for the amount of pressure and the amount of, the length of the stroke that's going to feel best for you. That's really helpful. And also, how I know and I want to touch my partner, but that pain level sort of prevents me from doing so. So how do I give Dan the love and attention that he wants? And more importantly, how does he ask for what he needs or wants without, I don't know, being selfish? I mean, how have you juggled that, honestly?
Well, yeah, it has been kind of difficult. And I think one of the things to note to me is the 5 love languages kind of a little bit goes out the door with this, because things have changed. You're not able to do some of the things you're normally able to do, and there's other issues now that are required. For Elizabeth, acts of service was certainly something that I was needing to do for her, and the way I was kind of coping with it. So, big thing is to talk about it. So for me, as we're getting ready to go to bed, people who know me, my head hits the pillow and I'm out. And she had forgotten a lot of things, and partly because of the pain meds, she wasn't quite there. And she would forget things, and then I'd have to go back downstairs and get more stuff. And this would happen 3 or 4 times, and it got really frustrating for me. So that's kind of when we reached our peak, if you will.
Dan hit a wall.
Yeah, I ran into a wall big time. And it was pretty difficult. And I was really tired. I didn't understand how tired I was going to get from this as well. Not really doing anything around the house like I'm used to, but still trying to get some stuff done. I mean, we've got a business that's going on. We've got to try to get things done as much as we can. And so I would try to get up early in the morning and try to get some of those done. But with her being in so much pain, I wasn't always able to complete those tasks. And with that weighing on me, with having to listen for her, and what's going on, so the vigilance center of my mind has totally been kicked off, and I'm listening in, and I really became exhausted.
Yeah, and it's also really important to understand that that's so typical for the caretakers, but nobody really talks about what the caretakers are going to go through. So we were unprepared, if you will, for Dan to hit a wall, and I was like, what? You're frustrated?
You're not doing anything. What's wrong with you?
I don't get it. You're tired. You're exhausted. And so one of our dear friends, who's a trauma nurse, she helped us to understand that Dan was actually hitting that wall right as if it were perfectly timed and on schedule. So the other important thing is that you need to ask, the couple needs to ask for outside support, because it's really too much and can create quite a strain. But, we have such a great foundation that we can talk about these things and say, oh, yeah, well, that's to be expected, and I understand it, and I'll try to get better about it. But the big thing when you're a patient for both of you really is to utilize patience, 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 and always rely on, okay, can you take that extra breath? Can you take those 2 calming breaths and resume whatever the ridiculous activity might be? Yes, I forgot to bring my Tylenol up that I need desperately in the middle of the night, and I didn't intentionally forget. So now we kind of have, yes, but we have a list of what comes upstairs with me from the living room every night.
She has a little backpack that she carries everything in as well.
Yeah. So, I mean, I'm making things easier. It's not that I'm trying to do everything, but if I can do, as I'm healing and getting better and better, are there more things that I can do to ease the strain on the caretaker? I also wrote in our newsletter some tips and some guides for how the caretaker can take care of him or herself, because that's really important, caretaker burnout. But back to, what we wanted to talk about really in this Naked Talk episode is the form of touch and how to ask and get what you want from your partner. So it is a little bit more challenging with the hip replacement or shoulder work or knee replacement when you go back into that intimate setting. So what does intimacy look like? It's a great way to explore how deeply intimate your relationship is without relying on just the sexual intimacy. Because we can attest that your regular lovemaking routine is going to be completely disrupted if existing if existing at all. And you have to know that, because the pain, my pain in this instance, the pain really takes the priority. And the pain kind of, when you say like rules the show, the less pain I'm in, the more mobility I have, the more flexibility I have, more movement I have, the more I'm willing.
The more self-reliant she is.
Yeah, and the more willing I am to probably engage in the sexual intimacy, the sensual intimacy, where really we've been intimate partners in this recovery process. We've been intimate. Bless his heart, he's had to shower me, and it's not the fun, sexy showers that we're all used to. They're, certainly not erotic as he's trying gently to scrub my back or wash over the wound. It's really, kind of a dependency that fosters a total level of intimacy that we don't often experience. Would you say the same thing for you?
Yeah, absolutely. And one of the things to know is that we often talk about talking or asking for what it is that you want in a relationship as far as touch is concerned, affection, whatever else it is. There's no different here, but things may have changed a little bit. So what I would normally do to touch her doesn't always necessarily feel as good because her body may be on fire and she's really touchy, no pun intended, when it comes to the touch that I do
really
provide
sensitive,
for her.
yeah,
very sensitive for that. So you do still need to talk and communicate as far as what it is that you want as the person receiving or the person who's actively giving to your partner, whoever it might be. Ask for what it is they want. And then also ask for what you need as well.
Yeah, so let's talk about that. In addition to needing that calming, soothing touch, what I've really wanted is just affection. Just to be close to him, to lay next to him, to spoon in the position where my leg, is supported, but just have that type of affection. The hand rubbing, the hand caress, that's so important. My face stroked. Really those more simple acts of paying attention and being sensitive to the needs of someone whose whole body is kind of in a fight or flight mode. It's absolutely been in a fight or flight mode. So now that things are calming down, different forms of touch, thank goodness, have come back into our relationship. So that's what I've needed, is affectionate and calming. What have you been able to ask for, and what have you received? Have you asked for what you wanted?
I really haven't. I've kind of put my life on hold at this point, as far as my eroticism even. I understand now why women who have children have harder times having sex, having climaxes, things like that. We talk about that. We teach it. When the vigilance center kicks off, women cannot have an orgasm. That's true with anybody. My vigilance center has been much higher. I'm listening for Elizabeth. She is, anybody who knows Elizabeth knows she's fairly dramatic anyway, and demonstrative, but she will make some screaming noises, and I'll immediately be on alert for what's going on,
she
what's
fell.
the matter. Yeah, did she hurt herself? Did she fall?
And basically, it's just I rubbed my anti-pain cream in a little too firmly. So, but my body reacts as if I've fallen. So, again, it's that level of communication and understanding. But I think it's really important. Talk more about that, because from a man's perspective, that your erotic desires and that your level of arousal, I think that's important to share with the audience.
What do you want me to share about?
Just more, that it's decreased, or, like...
Yeah, well, so I mean, it has decreased. It's not something that I've focused on. Uh, in the time that I do have to myself, I focus on the business at hand, trying to get things done. I've had to take on more duties around the house as far as,
He's actually done laundry.
yeah, laundry, dishes, more emptying the dishwasher, some of those things. And we kind of have our roles and responsibilities in our relationship, and I've had to take on more of those duties. And so it just hasn't left a lot of time for the eroticism, as well as the fact that my partner's not just available for me in that way. So it's just kind of been shut off at this point.
And it can really try and strain some couples. And we definitely wanted to talk about that because, you know, from our experience, if we can guide and educate you all, maybe if there's something that's in the works, a partner's going to have knee surgery or the same thing, hip surgery, which are more and more common in our age group, you can expect these things that you aren't taken by surprise. Not many doctors, so when we asked, so when can we return to sex? They just sort of said, well, whenever. It's like, no, what do you mean whenever? Am I gonna hurt my hip? Am I gonna hurt the joint? And what they've said is that most of the recovery is at your comfort level. When can you feel secure enough standing on both legs, in my case, balancing and giving full body weight to, in my instance, it's my left hip, but giving full body weight over on the left hip. It's really being very, very attuned to what the body is feeling, what the body is sensing, and then helping your partner understand that as well. I mean, quite honestly, that's been the last thing that's been on my mind. But I'm also wanting to take care of my partner. You know, so are there ways that when I'm feeling good, and I'm not on the drugs, but are there ways that when I'm feeling good that I can touch him or I can please him and I can pleasure him in ways that I still feel protected, I still feel supported? You know, maybe I can put a whole bunch of different pillows to support myself in ways where he can receive some pleasure. So that's something that each couple gets to explore.
Right. And now I would also make sure you talk to your doctor. In Elizabeth's case, with a hip surgery, they just told us recently that you really can't do much to it at this point.
Hurt it.
Right.
Yeah.
Because the joints are in place. I mean, yeah, you're not supposed to go skiing moguls or jumping on trampolines or anything like that, which we don't do that.
Or running the boulder. No.
Right. But the primary concern is really the tissue of her skin coming back together. They don't use staples, or didn't use staples in her case.
They used a glue.
Or stitches or any of that stuff. Yeah, it was a glue and a tape that put it all together. But if you've got some other kind of injury, I mean, maybe it's abdominal surgery, something like that, and yeah, talk to your doctor and find out when it would be appropriate for you to step back into having intimate relations.
Yeah. And that's the other thing, is be really truthful and open with your partner, with your doctor or the PA, whomever, the nurses, and say, look, we have a really active sex life and we want to resume when, the only thing that I'm able to tell you is what they told me specific to my to my hip surgery. I've only had Advil today, people, so don't think I'm still on the pain meds. But so Dan's absolutely right. We can't guide you for any other surgeries because you may be on pain meds more than I chose to be. You may have a very limited range of movement, I know, for shoulders or elbows or things like that. So really be clear with your doctors. And if you're...
And they're expecting it. They know. The PT that we were talking to with Elizabeth, that was a question that kind of came up early in our conversation. But she said, it's really funny because everybody's dying to ask that question. She gets that question a lot, but it's usually right at the very end when they're getting ready to walk out the door. One of the partners clearly has been itching to get into the sexual mode again. And okay, we've got to talk about this at some point in time. And this is the last, 11th hour. I'm walking out the door. I've got to do it. And then you don't have a lot of time to actually discuss it. It's just kind of a quick, well, yes, you can, or no, you can't. Here's some things you might need to be cautious of. Now you have to leave. So ask earlier in the process so you can go through what kind of issues there might be.
And we asked about it, as Dan said, we asked about it right away. But there's some things that you would think might feel really good, like bathing together, taking a bath, being luxurious with maybe bubbles and whatever lotions and potions. But you have to be really careful about that because of whatever the type. I have to be really careful because of the wound, meaning where the site of the incision.
Until
And we
it's
wouldn't
healed.
think, yeah, you wouldn't necessarily think to ask. They obviously want you to keep the site clean, but you could do that in a shower. But sitting in a bathtub where you may feel, or that may sound wonderful, it's actually counterindicated. Is that the word? Contraindicated in my case. So, like maybe sitting in a hot tub, is that going to relieve my muscle aches and tensions? That's the last thing that my doctors want me to do. So, again, we just really want to suggest that you take all of your questions to your PT, to your doctor, to the PA, or call a nurse. If you're embarrassed to have the conversation face to face, all of the doctors have nursing staffs and what are they called? PA? Physician assistants that are more than happy to talk to you about this. Their questions, they're there to help you and comfort you and ease you back in. That's a great thing to say. Ease you back in to a more normal or your more normal routine. And in some cases, quite honestly, you're going to reset what's normal for you.
And if your doctor or whoever professional is uncomfortable talking about it, then you probably don't want that doctor anyway, because they're going to be short-sighted in what it is that's available to you and not supportive, and that just isn't right.
Yeah, and let's be honest, that sexual energy, that orgasmic energy is so healing for all of us. So, when can I return to self-pleasuring? Again, what I've been told is at my pain level. The pain really is
Dictates
my guide and is the couple's guide. So, what else? What have you... I'm hearing that your libido or your desire has decreased, and it sounds quite appropriate. What would you like to explore? If there is a desire, are you hungering for anything? Is there something that I can do to help take care of you that helps us stay connected and feel close?
Around sex or
just intimacy, affection?
I think I'm getting some of that now because I am taking the time to do some of the things that I need to do. Scheduling it. We talk about scheduling for intimacy anyway, and I think that's so valuable here as well because we've got a lot of things to do, and things are piling up because we don't actually sit at our computers right now. So things are piling up. And I think scheduling intimacy sessions is really valuable because then once I know that I've got this on my calendar, then I'm not thinking about all the things that I have to do. I know that I can let it go because I've set this time aside to be able to do that.
And I think that's a really important point, especially for the pain management, if you will, because as I said, I'm taking Advil, but I'm also taking Tylenol. I take them cyclically, one every 4 hours and the other every 6 hours. And so scheduling our time together is during, if you will, the peak of when the pain medicines, well, if they're called pain medicines, but those meds, over-the-counter meds, start to take effect. You don't want to schedule your intimate time for the end of that pain cycle or the very beginning, or that med cycle or the very beginning. You kind of want that Advil or that Tylenol to be in your body so that your pain is reduced when you're going to express that sexual intimacy together.
Or any kind of intimacy.
Yeah, so I think that's an incredibly valid point. But you're going to have to really rely again on the patient knowing and being able to dictate that schedule for a little bit. We're flexible, we're working with it, but I don't want to do it at the end of that 4th hour before the next Advil gets sucked down.
Right. The other thing I found really helpful is we reached out to a lot of friends and had them support us. Just as simple as making a meal for us. So, normally I do a lot of the primary cooking, but not a lot of the vegetables and things like that. And so these people brought over food that was really tasty, was different from what we're used to eating, which was great. So it provided a variety, and I didn't have to cook it. And so I could spend more time working with her. Or we had the same trauma nurse come over, and she spent the entire day with Elizabeth. So I could sit down and work on my computer and kind of catch up with some of the things that were starting to weigh down on us.
Yeah, and so that's kind of like, a dear trusted sister, dear trusted friend. She just lay in bed with me, and we talked, and we had great conversation. She was rubbing my arms. She was just caressing. She was playing with my hair? She may have been stroking my hair, but just so gentle and so touching that, that's a form of intimacy. And I was able to ask for something different. It's not like Dan has expectations, but I was just able to sort of be that, she was more aware of what the needs were and my level of pain, because she has an understanding very different from Dan, being that trauma nurse, of what would feel intrinsically, what would feel good. And also she's practiced it. She's been with people who just a cold, damp washcloth on the forehead is like pie and ice cream, for the rest of the world. That can bring as much relief as that gentle, hand on top of the other person's hand, or just that gentle caressing. So again, she knew the different types of touch that would feel good, but she also asked me before she did it. So I think that's, another thing that really helped us.
Well, and I think also one of the things Elizabeth wanted me to do was just sit with her and hold her hand.
I did.
And first thing in the morning, I'm okay with that. I can do that. In the evening when we're going to sleep, I can do that until I fall asleep, which is about 30 seconds into it or sooner.
Or less.
Yeah. But in the middle of the day, when I've got a lot of things on my mind, a lot of things are going on, I don't have the patience for that. So it was really tough for me. I mean, I wanted to get a book.
Because he had to develop some.
Yeah.
So what we ended up doing was we found our ways around it. If there was something that he wanted to read, I didn't actually need him to be fully present with me. But if he wanted to read, and I would just lay next to him, as we described earlier, then he would just be slowly caressing my arm and getting whatever done that he needed to get done. And we just actually worked on that together. And we both got what we wanted out of it. So
it's a compromise. You work with each other and negotiate what works for the two of you in the best way that it can.
So I think in summarizing, I think the train of thought that's been going through here is something that we've talked about all along in most of our Naked Talks or our teachings, is a level of communication that's needed between the two partners during any type of crisis, any type of, long recovery. It's really about how well you communicate with each other, how clear you can be, and asking for what you want and what you need without feeling like, I've been very, very needy, and no apologies. It's just the state of my physical condition. And Dan knows that if anything ever happened to him, I would be doing the same for him. No questions asked. I probably would experience the same frustration, but all of these things are to be expected, and they're completely normal. So we're really no different than any other couple, except for we may have a leg up on some of you in terms of our ability to communicate clearly. We're not always perfect. Dan hit that wall. I reacted, but now we know what?
Nothing.
Oh, now we know that that's to be expected. So we're trying to disseminate information so that you can navigate any type of planned surgery or any type of unexpected injury and what may happen post-surgery or post-injury. So any last thoughts? Because I think we need to wrap it up.
Yeah, I think we're good. So
Okay. So I will give my little speech. That about wraps up tonight's episode of Naked Talk. We want to thank you for being a part of this potent conversation. And as always, if you have anything that you'd like to have us discuss, by all means, submit questions, submit topics of areas of interest that we can explore and bring you information that might be useful to you.
yeah, and you can send that to questions@betevents.com, and I'll put that right down here somewhere.
In the editing.
Yeah.
So as spring is here, we hope everybody is well, and we look forward to seeing you in the next episode of Naked Talk.
Yeah. Thanks.
Great.
Have a great night, everybody.
Thank you. Bye.